Hello everyone and welcome to our discussion about the possibility of language models, like ChatGPT, replacing doctors. With the rapid advancements in technology, we are faced with an exciting question. Could these models one day be capable of accurately diagnosing diseases and illnesses without the need for human intervention? The thought of having access to a reliable, constantly updated database of medical knowledge, with the potential to diagnose conditions accurately and even potentially for free, is both intriguing and revolutionary. In this video, we will delve into this possibility and explore the advantages and limitations of this new technology. We will also consider how it could potentially help people, especially in poor countries, who struggle to access quality medical care. So, sit back, relax, and let's discuss the future of healthcare. The possibility of ChatGPT or other language models completely replacing doctors is a topic that has been widely discussed in recent years. The healthcare industry is constantly evolving and improving, and the use of technology has become an increasingly important part of this evolution. In this text, we'll explore the potential benefits and drawbacks of using ChatGPT or other language models in healthcare, and consider whether these technologies have the potential to replace human doctors. One of the main arguments in favor of using ChatGPT or other language models in healthcare is the potential for these technologies to help people in poor countries who may not have access to medical care. With the ability to process large amounts of data and have access to a constantly updated database of studies, ChatGPT and other language models could potentially detect new symptoms and diseases more accurately than a human doctor. This is especially important in areas where medical resources are limited, and where access to healthcare is a major challenge. Furthermore, ChatGPT and other language models could make healthcare more accessible and affordable, particularly for those in remote or underserved areas. Another advantage of using ChatGPT or other language models in healthcare is that they could help to reduce the workload of human doctors. With the ability to process large amounts of information quickly and accurately, ChatGPT and other language models could assist human doctors with diagnoses and treatment plans, freeing up time for doctors to spend more time with patients and to focus on more complex cases. This could help to reduce the stress and burnout that many human doctors experience, and could lead to improved patient outcomes and overall quality of care. However, it's important to note that ChatGPT and other language models are not without their drawbacks. One concern is that these technologies may not be able to create a rapport with patients, which is an important aspect of healthcare. Building trust and understanding with a patient is crucial for accurate diagnosis and treatment, and a human doctor is better equipped to do this. Additionally, there is always the risk of errors and misdiagnosis with any technology, and the question of accountability for these errors arises. On the other hand, it's worth mentioning that the current system is not without its drawbacks. Some doctors, especially in poor countries, are overworked and underfunded, leading to burnout, mistakes and lack of quality time with patients. This can lead to a lack of accurate diagnoses and proper treatment, which is a serious concern. Another potential drawback of using ChatGPT and other language models in healthcare is that they could further widen the healthcare divide between rich and poor. If these technologies are only available to those who can afford them, then access to healthcare could become even more unequal, and those in lower income communities could be left behind. This is a serious concern that must be taken into account as the use of these technologies becomes more widespread. Despite these concerns, the potential for ChatGPT and other language models to revolutionize healthcare is undeniable. These technologies can be used to improve the efficiency and accuracy of diagnoses, as well as to make healthcare more accessible to those who might not otherwise have access to medical care. For example, ChatGPT and other language models could be used to provide telemedicine services in remote or underserved areas, allowing patients to receive medical consultations from the comfort of their own homes. This could help to reduce the burden on local hospitals and clinics, and could improve access to care for those who might otherwise have difficulty traveling to a healthcare facility. It's also worth considering the potential impact of ChatGPT and other language models on medical education and research. With the ability to process and analyze vast amounts of data, These technologies could help to identify patterns and correlations that might otherwise go unnoticed. This could lead to new breakthroughs in the medical field. While the potential of language models like ChatGPT to replace human doctors is exciting, it's important to consider the limitations and drawbacks of such a system. Despite the advanced capabilities of these AI systems, they are still in their infancy and are not yet capable of fully replacing human doctors. However, it's worth exploring the potential benefits of such a system, especially for people living in countries with limited access to healthcare. One of the biggest advantages of a language model like ChatGPT is its ability to process and analyze vast amounts of data. With access to a database of studies and information from around the world, a language model can potentially diagnose diseases more accurately and quickly than a human doctor. This could be especially beneficial for people living in rural areas or developing countries where access to healthcare is limited. With just a few clicks, people can potentially receive a diagnosis and determine if they need to see a doctor in person. Another advantage of using a language model for healthcare is cost savings. Going to the doctor can be expensive, especially for people who don't have insurance. With a language model, people could potentially receive a diagnosis for free, saving them both time and money. Additionally, language models can operate 24/7, which means that people can receive a diagnosis at any time, regardless of whether a doctor is available. However, it's important to remember that language models are not perfect. They are only as good as the data they are trained on, and there is always a risk of misdiagnosis. Additionally, language models can struggle to understand the nuances and complexities of human behavior, which can make it difficult for them to diagnose certain conditions accurately. While the potential benefits are great, it's important to weigh these against the potential risks. So, what do you think? Would you trust a language model like ChatGPT to diagnose your medical condition? While the technology is still in its early stages, it's exciting to consider the potential benefits it could bring to people who don't have access to quality healthcare. It's important to continue exploring the potential of this technology, while also being mindful of its limitations and potential risks. In conclusion, while language models like ChatGPT have the potential to revolutionize the healthcare industry, they are not yet capable of fully replacing human doctors. With their ability to process vast amounts of data and provide quick diagnoses, they could be a valuable resource for people living in countries with limited access to healthcare. However, it's important to consider the potential risks and limitations of such a system before fully embracing it. So, what do you think about the possibility of language models like ChatGPT replacing human doctors? Do you think this technology could be a valuable resource for people living in countries with limited access to healthcare? Let us know in the comments below, and don't forget to like, subscribe, and hit the notification bell to stay updated on the latest technology and healthcare news. Thank you for watching.